Provinces looking for a permanent increase to the Canada Health Transfer didn't get one yesterday. There was no commitment in the fall economic update, and Prime Minister Justin Trudeau would not guarantee one in comments he made today. Trudeau and the premiers, though, are set to meet next week, December 10th, to discuss health funding and the vaccine rollout plan. Blaine Higgs is the Premier of New Brunswick. He joins us to talk about that from Fredericton. Hi, Premier. Good to see you as always.
Good evening, Nancy.
Any surprise that there was no sort of commitment to the CHT or an increase to the CHT in this update?
Well, disappointing, I guess, given how money's been flowing in the past months, and it didn't show up in other announcements that we thought it would. I guess I wasn't surprised, but disappointed. It has been the one single item that every premier and territory leader has asked for in a letter to the Prime Minister back months ago. And it's something that's critical to our ability to maintain our health services in each province, but it's even more critical during the COVID and the dealing with the pandemic. So we need stability there. There's a lot of money flowing, as we can see, and we heard yesterday, which is fine. I mean, I'm very concerned about the long-term vision and future of our economic state, but it's like there needs to be money for stability of what we're currently faced with. And we're currently faced with healthcare costs that are getting higher by the week.
The mention that was in the statement around the Canada Health Transfer was the government pointing out that when you take into account the money that it's transferred to provinces through the Safe Restart program, it actually amounts to a 23% increase over what was transferred through health transfers last year. And I asked the finance minister, are we to interpret that a permanent increase isn't coming? She very carefully answered the question, but certainly didn't say, no, premiers can be assured there is something permanent coming. It seems like they're laying the groundwork to say, hey, we're already giving provinces a huge amount of money.
Well, that's concerning because that money that has been given out to date through this pandemic has been prescribed money for certain particular issues that were, let's say, federal agenda items. And, while we've been recipients and very appreciative in certain areas that have been important to all of us, so I don't want to undermine that at all. But it is important to recognize the long-term view of costs that we're incurring. And when we look at stability going forward, it's like, let's understand what each province is facing. This is something that's not a federal priority or any more so, but it is every provincial and territorial priority. So why isn't that something that the federal government would look at and say, okay, there's other things we're doing. We don't need to do so much of that, but we do need to get stability in healthcare for the future in our country, and that starts with every province setting and meeting those priorities that are already identified.
To be fair to them, I mean, they do point out that 8 out of every $10 that have gone to support people in this pandemic across the country are federal dollars. They have increased the amount of health funding, and I know you're saying that's in some areas of federal some sort of federal areas of interest, but contact tracing, testing, they've given a lot of money for that as well.
Absolutely, Vassy, and I don't take anything away from that. So we've been all thankful for what we've received through this pandemic, and the federal government has certainly been doing their share in providing financial support to all of us. And so where we are now and facing the economic realities of trying to restart, vaccines in the offing, so we're going to be moving back to a normal way of life. It's like, let's look at beyond what could be the next election. Let's look at what we need to be sustainable, getting started up in the real terms of what we're facing, and then moving beyond the COVID timeframe. That's the point, is let's have those real discussions. So we're seeing, hundreds of billions of dollars and $100 billion initiative that's being promoted as an economic restart after the pandemic ends. Well, we have a healthcare crisis that will continue for generations. And let's focus on some of these sustainable issues that, unless we find a solution, will not be sustainable in the future ahead.
You spoke about that letter that the premiers all wrote together, and there certainly is consensus on the issue from the premiers. My understanding was that the Prime Minister had responded saying there would be a call solely focused on the CHT, the Canada Health Transfer. Is next week's call that call? Is that your interpretation of it, or will there be add-ons? It will be.
Yes, you're correct. It is set up for December 10th. And so it is, the focus is CHT. I'm sure that there will be discussions around vaccines and availability and how the distribution is going to work across the country. Likely it'll fall into that too. We've seen a lead up into this in terms of long-term care and what that looks like, which is all part of healthcare, all part of the provincial responsibility. But yes, this December 10th meeting is all about Canada Health transfers, and I'm hoping that it recognizes a path for us to get to a sustainable cost structure.
On vaccines, a lot of conversation about, and I know it was discussed in the last call as well, but a lot of conversation about what the rollout plan will look like. Has your government received any more concrete answers about timing for New Brunswick, and what about your own plan?
Well, certainly we have put our emergency measures coordinator in charge of our distribution, but it depends on what the availability is going to be. At this point, we believe that we could see around 60,000 patients have vaccines available. That's over the first quarter of the new year, and so we're looking at what timing would they arrive if that's the case, and that was based on the 3 million doses that are available and looking at a per capita distribution. But we need to know what the timing is of delivery, and then we'll work on the distribution model. And our intent was to have this all laid out for December. We spoke to the PM just this week on that very issue, and then be ready to receive, from which the Minister Leblanc had laid out the pattern for the first of the year. So I think we can manage the logistics. We've already been in contact with the military who are offering assistance. But if we know the timing of delivery and the quantities, then we can decide whether it's going to be a problem or not. Some are related to a problem just by their nature of storage, as we know, with the Pfizer vaccine. So that poses its unique challenges. But I think we need to just know what is coming, when. And I don't think there's going to be a massive lineup at the door. I think that people, if they understand when and how they're going to have the opportunity to receive a vaccination, I think they'll be very thankful that we actually have a vaccine.
Okay, Premier, I'll leave it there. Thanks for your time, as always.
You're very welcome.
Blaine Higgs is the Premier of New Brunswick. Hi, I'm Vashi Capellos, host of Power in Politics. See more of our show by subscribing to the CBC News channel or click the link for another video.